Pain Management in Hip and Knee Arthroplasty by Yasha Blunt. What is a hip and knee arthroplasty? Arthroplasty is a surgical procedure in which the hip or knee is replaced by a prosthetic implant. Orthopedic surgery is conducted to relieve arthritis pain or fix hip fractures. More than 600,000 cases are documented yearly in the United States. Arthroplasty results in improved mobility and a better quality of life. This research addresses the following question. In patients with hip and knee replacements, how effective is PCA pain medications in comparison to multimodal pain medications in controlling post-operative pain during the perioperative and recovery time? Pain is a distressing feeling often caused by intense or damaging stimuli. The International Association for Study of Pain describes pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. 80% of patients experience acute pain after surgery. Consequences of severe pain lead to extended hospital visits, hospital readmissions, and delayed rehabilitation. If pain is not managed effectively, patients abuse narcotics, which could lead to CNS depression, constipation, nausea, and vomiting. There is no gold standard that exists for the management of pain after arthroplasty. The gait control theory was described by Ronald Melzack and Patrick Wall in 1965. The theory explains about a pain-modulating system in which a neural gate present in the spinal cord can open and close, thereby modulating the perception of pain. Pain is best recognized while the gate is open, but is less intense or not detected when the gate is closed. The gate is opened by physical factors and may be closed by physical pain. Hip or knee replacement surgery would be the physical factor opening the gate, influencing the perception of pain. Analgesic antidotes would decrease the physical pain, potentially closing the gate. This theory guided research towards the cognitive behavioral approaches to pain management. The theory opened windows of opportunities for research and efforts to achieve optimal pain management, not only in post-operative hip replacements, but also pain management in general. The gate theory transformed the area of pain, and it has paved the way for further research aiming towards painless recovery for post-operative patients. This next portion describes the literature review. Pain Management in Total Knee Arthroplasty is an article that analyzed the effects of multimodal analgesic regimens compared to patient-controlled PCA. 36 patients undergoing knee arthroplasty were randomized to either receive periarticular injections and multimodal analgesics or a hydromorphone PCA pump. The multimodal group consisted of 19 participants who received oxycodone, tramadol, and toradol scheduled. The PCA group consisted of 17 participants who received IV dilaudid PRN. 16% of the patients experienced adverse effects in the multimodal group compared to 94% of the patients in the PCA group that experienced adverse effects. The VAS scores were lower in the multimodal group than in the PCA group. Satisfaction scores were significantly higher in the multimodal group, as well as the functional ability. Postoperative data was collected for the VAS pain scores, physical therapy milestones, hospital stay, patient satisfaction, and narcotic consumption. The multimodal group had lower VAS scores, fewer adverse effects, lower narcotic usage, and higher satisfaction scores than the PCA group. Multimodal pain management protocol decreases narcotic usage, improves pain scores, and increases satisfaction. Pain management after total knee arthroplasty using a multimodal approach. In this study, 90 patients who elected to have a knee arthroplasty were randomized into two categories. PCEA FMB group consisted of 45 participants with patient-controlled epidural analgesics with femoral nerve block. These participants received 30 cc bolus of fentanyl prior to surgery. After surgery, they were administered tramadol, oxycodone, acetaminophen, etc. for PRN pain medication. The PAI group received periarticular injections prior to surgery. These injections consisted of Marcaine, morphine sulfate, and adrenaline that was injected into the posteromedial structures, posterior capsule, and the periarticular synovium. Adverse effects for the F&B group included respiratory depression, nausea, vomiting, urinary retention, bradycardia, and hypotension. The PAI group had no adverse effects with the exception of pain or redness at the injection site. There was no significant difference between the two regarding pain. Pain scales were slightly decreased in the F&B group, but the PAI group consisted of less side effects. Metoclopramide improves the quality of tramadol PCA and distinguishable to morphine PCA is a prospective randomized double-blinded clinical comparison. In this study, 60 patients undergoing elective knee arthroplasty were divided into two groups to compare patient satisfaction and pain control. Group M consisted of 30 patients. These 30 patients were administered morphine PCA. The morphine PCA pump consisted of 0.2 milligrams per kilogram of morphine and postoperatively 1 milligram of morphine per bolus. Group T also consisted of 30 patients. These patients were administered tramadol 2.5 milligrams preoperatively, and postoperatively they had a PCA pump that consisted of 20 milligrams of tramadol plus 1 milligram of metoclopramide per bolus. Measured were vital signs, pain, patient satisfaction, drug delivered, sedation, and side effects. The study revealed there is no significant difference and no determination of best practices for PCA. However, it is suggested that the combination of metoclopramide and tramadol is comparable to PCA morphine. The limitations to this study was that these studies were recorded only in PACU. This data should have been recorded at least until the time of discharge. Periarticular infiltration for pain relief after total hip arthroplasty is a study that aimed to assess the efficacy of periarticular infiltration in pain relief after hip arthroplasty. 63 patients undergoing hip arthroplasty were randomly assigned to receive either analgesia with continuous epidural infusion or intraoperative periarticular infiltration with morphine, epinephrine, and corticosteroids, or PCA with morphine. Recorded were the following measurements: morphine consumption, VAS scores at rest, blood loss, mean arterial pressure, and adverse effects. Morphine consumption and VAS scores were lower in the infiltration group compared to the PCA group, but did not differ between the infiltration and the epidural group. There was no difference in adverse effects in any of the groups. MAP was higher in the PCA group and blood loss was lower in the infiltration group. It is suggested that periarticular infiltration was superior to PCA morphine after total hip arthroplasty. It provided better pain relief and lower opioid consumption postoperatively. Infiltration is equally comparable and effective to epidural analgesia without having the potential side effects. Characterization of patients undergoing total knee arthroplasty in a real-world setting and pain-related medication prescriptions for management is a study that characterizes medication use in the immediate post-operative period among patients undergoing knee arthroplasty. 168 patients were chosen from the Orthopedic Center at the University of Utah. 60% of these patients experienced severe pain after arthroplasty. Patient outcome measurements included pain, physical function, and quality of life. Medications that were used post-operatively included oxycodone, fentanyl, morphine, midazolam, and gabapentin. Findings were as followed. 64% of the patients were discharged home as opposed to being admitted into a rehab facility. The average length of hospital stay was lower than the expected national average. There was a decrease in pain and an increase in physical function. Physicians reported the level of function at 6 weeks was good and excellent after 6 months. Periarticular multimodal drug injection and total knee arthroplasty is a systematic review and meta-analysis that studied the benefits of periarticular injections with multimodal drugs. 835 patients met the criteria using electronic search in numerous databases. Patient outcome measurements included pain, straight leg raises, complications, and hospital stay. The experimental group received periarticular injection with multimodal drugs. The findings are as follows. There is no statistically significant differences in operating time, hospital stay, or wound complications. Periarticular injections with multimodal drugs is associated with short-term benefits in terms of pain, relief, and straight leg raises. Ethical considerations. An ethical consideration is an accumulation of values or principles that address questions of what is good or bad in human affairs. An ethical issue that could impact this research is informed consent. Informed consent is a process for getting permission before conducting a healthcare intervention on a person. Verbal and written consent was a requirement from all subjects participating in these studies. Another ethical issue that may impact this project is benefits and harm. Benefits is something that is advantageous or good, an advantage. Risk or harm is exposure to the chance of injury or loss, a hazard or dangerous chance, physical injury, or mental damage. These studies require participants to consume oral pain medications as well as receive intravenous therapy. There are risks and side effects to the medications such as constipation, dependence, addiction, and itching. In participating in this study, researchers need to address potential risks and benefits with participants. Special consideration should be taken to ensure that the benefits outweigh the risks. Possible grant resources. The Orthopedic Research Society's sole purpose is to support, develop, promote, and encourage research in surgery and musculoskeletal diseases. They sponsor many educational activities. Their core values include innovation, scientific excellence, advocacy, and diversity. Their goals are to empower with knowledge and resources needed to thrive, increase effectiveness in improving research, and increase governmental, industrial, and private funding for musculoskeletal research. This organization strives to increase awareness that the burden of musculoskeletal problems bring, increase funding for research, and increase funding from donors. Hip and knee arthroplasty falls under the orthopedic realm. I chose this organization because they offer grants and funding for orthopedic research. In summary, periarticular infiltration has been proven to be a safe and effective analgesic to manage pain after arthroplasty. When metoclopramide is used in combination with tramadol, the results are comparable to morphine PCA. Multimodal analgesia utilizing meds such as oxycodone and hydrocodone have also been effective in reducing the severity of pain postoperatively. In conclusion, the use of multimodal analgesics for pain management in hip and knee arthroplasty decreases the amount of narcotic consumption, improves pain, has less adverse effects, expedites physical therapy goals, and has a higher patient satisfaction rate.